And here on Sac & Co, Medicare is a program that so many elderly and disabled around the country depend on for their health and benefits and prescription medications. However, benefits are changing all the time, and it can be really hard for our average consumer to actually keep track of changes to their current plans. And so coming up right now, we have a guest that we really would love to share with you, and we're talking about South Bay Health and Insurance Services. They've actually made their mission to serve as a resource to educate seniors and others about their Medicare plans and programs. So here to tell us about some specific Medicare changes that could affect you is South Bay Health and Insurance Service President. We have Patricia Salas. Patricia, thank you for being with us on the show here. You've done such a great job sharing really important information with our viewers about Medicare, but let's go ahead and talk about South Bay Health and Insurance Services. First of all, what are you and what do you do?
We're an insurance agency that specializes in helping people that have Medicare or Medicare and Medi-Cal choose and find the plan that best suits their needs. We do this at no service to them, and it's very difficult to make the decision. So we make the decision of choosing an additional plan to their Medicare simpler.
Okay, so let's talk about Medicare too, because I understand there's been an open enrollment period, and help our viewers understand exactly what that means and why it's so important that they take advantage of this.
Correct. So Medicare recipients have an annual enrollment period that happens between October the 15th through December the 7th. So we've been open for almost 15 days already, and we have about 37 left or so. During this period, people who have Medicare can either change their Medicare Advantage plan, or they can add a prescription drug plan. They can make changes to that additional coverage that they need. It's difficult to know what applies, and in areas such as the Central Valley, there weren't many choices that were available to them in the past. So people here had a tendency to do one of two things. If they had the income, they would purchase a Medicare supplement, which is kind of expensive, but it gives them more choices and more options as to where to get their care. There are many people who can't afford that, and they chose to remain Medicare only or original Medicare with no additional coverage. Since last year, we've had a number of companies, insurance companies, make new plans available in the counties in the Central Valley. So this makes it very unique. It's this time period so that people can see what the offerings are, what makes sense, what's most affordable, and what they can use. What we do again is we help them understand the differences in the different plans. We explain how they work, and the good thing is that most of the ones that have been introduced are at zero monthly premium. So this is great for those who couldn't afford a Medicare supplement before because it was too expensive. Now they can choose a plan and pay nothing for it per month.
Wow. Okay, but that window though to take advantage of that though,
very short.
It's very short. So it's happening now till
December the 7th. It ends on December 7th.
Okay, so it ends December 7th. But as they enter into this period though, they really need to make sure that they do their research, that they contact you so they can select exactly what's right for them.
Correct. Since really October the 15th to now, I think in the Central Valley area, we've helped over 2,300 people find their plans. And as an agency, we're very busy. So what we recommend is that you please take advantage of this opportunity. Call the number that's on screen and request that someone either comes to your home. We do this at no charge. We do it in multiple languages, and we explain the differences to you, help you find a plan that makes sense. If you prefer to come to one of our presentations, call the number that's on the screen. They'll let you know where the closest meeting is taking place, have a cup of coffee and a slice of pie, and learn it there. But please don't go without the information because it's desperately necessary.
And I imagine too, it's not just in the individuals that are pursuing this information that's for them, but maybe even their children that know that their mom and dad may need this assistance to make sure that they are taken care of.
You got it. In many instances, if we have a recipient who has no additional coverage other than their regular Medicare, if that person falls into the hospital and they end up having to pay the deductibles and additional fees because they didn't have a secondary plan, it's the family members who step up and pay the bill because the senior doesn't have it. So it makes a lot of sense that if the family has a group who are caregivers, loving family members, etc., that they get involved and make sure, hey mom, dad, do you have a Medicare Advantage plan? Do you have additional coverage through Medicare, or do you have Medicare only? If the answer is I just have my Medicare but I never go to the doctor, those are the patients we want to talk to right away because they're the ones that are at the most risk.
And I imagine too that there's probably some viewers that are like, oh, I have Medicare, I've had it forever, I'm comfortable, I'm fine, I really don't need to pursue. But why is it so important that they really stay on top of all the changes?
As we get older, the chances of having a catastrophic event, a heart attack, a fall that breaks your hip, etc., get greater and greater and greater. It's just exponentially higher. So the chances of you needing the Medicare and having to access it become more realistic. It is those patients who end up losing the most because they have the incident happen, they didn't have additional coverage, and they have to make up that bill that they're responsible from either their savings, which they save for a lifetime, from equity in the home if they have any, from loans, etc. So it makes a huge difference in their life, particularly to someone who's living month to month on a very limited income.
Exactly. And then how do people reach you for that assistance?
Our number is 1-888-988-8072. Feel free to give us a call. We are there to give them more information. The phones are just staffed from 8 to 8. So, they can have their questions answered, but the most important thing is we'll send someone to their home at no cost to help them there and assist them through the navigation.
That's great. And as you mentioned, that window is a short one, so make sure you take action now.
Call now.
Excellent. Thank you so much, Patricia.
Thank you.